Steele. I'm the CEO for Pamela Steele Associates. It's the 22nd of November 2018, and I have the privilege to sit down with Dr. Gamal, the Director General of NMSF, National Medical Supplies Fund, for a few minutes on NMSF under your leadership. Thank you for the opportunity to share your knowledge of NMSF with us. I have followed your work over the years and have been impressed with the work you have done with your team. For the sake of those who don't know NMSF, could you start by explaining to us what does NMS stand for and what does it do?
First of all, thank you very much for giving me this opportunity to share our experience with our colleagues worldwide through the PSA. So I'd like to thank you for coming and for your time. NMSF stands for National Medical Supplies Fund, which is the procurement agency, we can say, for the public sector in Sudan. It is responsible for all supplies, health commodities, medicines, vaccines, furniture for health facilities, beds, all this kind of medical device. We have more than 5,000 different items for health. We are mainly cost recovery or self-financing public organization with its own act, which passed by Parliament in 2015. But according to this act, we are responsible for the availability of medicine down to the bottom of the supply chain and service delivery points through our branches in different states.
Thank you very much. In commercial terms, the word customer refers to the person who pays for your goods or services after it has been delivered. In your sector, who is your customer?
Actually, we use this term mainly for more or less similar to the private sector, but we are working on we describe ourselves as, we are conducting business in public sector.
Mm-hmm.
So we use all the terminology used by private sector, especially in private companies. We borrow this terminology to improve our quality of service. We are not like other civil service organizations. So our customers are mainly the public organization, public health facilities, and public health organization like National Health Insurance Fund. Even the military of Sudan, national forces, is supplied by us. So we use this terminology and all our duties and management style is like business oriented. So this is why when we talk about customers, we talk about how to, later on we talk about how to satisfy them. To satisfy them, we have to have a special kind of staff to do this kind of service that satisfy our customers, improve the service that we provided, improve the quality of products that we provided, the prices, all this kind of things.
So I'm sitting here in your executive office, which looks very nice with good atmosphere, and it's the same atmosphere one finds in the whole compound with everything well organized. I'm sure it wasn't like this. What has been NMSF's milestones to get to where it is today?
Yes, it is not an easy job, especially in the public sector organizing this kind of settings in this part of the world, and for so many reasons, even sometimes the culture itself. But being there, live for some time in both countries, and I am a person who tried to improve the quality of service that I provided. So we work very hard, very, very hard to improve the environment, to avail a very conducive environment for our staff. So we started with this, for example, cleanliness. Cleanliness is not an easy job. So to do that, we sourced out the service of cleanliness. We train, even, you can't believe me if I tell you that, we even train the females how to use the toilet, for example. Really, this is true, by the way.
Yeah.
We draw somebody and train them from the Islamic University to train them how to use this.
Yeah.
We bring one of the religious scholars in a very big talk to train my colleagues. I also attended that talk. how to use the resources of the public resources wisely.
Yes.
Even the time, he told them about the time. The time is not yours. The time is your customer time.
Yes.
So you have to use it in a very rational way. So this is how we do a lot actually.
Very good. So what are the hallmarks of NMSF that have ensured good governance?
This mainly, we work with the rules of law. I'm that kind of person. So when I came here for the first time, I disseminated all the regulations, for example, Civil Service Act, Accounts Act, and all this kind of things, medicine bosses to inform them how we can work and follow the rules. The rule of law is a very important issue. So what made NMSF distinguished from other, maybe this one. For example, you can't see people moving around. All of them are in their offices. All of them work very hard. It wasn't like that before, So there's so many other things that we work on it to make the NMSF distinguish and to provide a very good quality service to our customers and to ourselves even. By computerization, electronization, all these kind of things we install them and to improve the quality of service. Before, when I came, I'm not sure the time, but when I came for the first time here in October 2010, there's no internal email. They use Yahoo. Yes, they use Yahoo, personal address, and they use it for all the staff.
Wow.
And the IT person every morning go and open it in one room, and everybody come and see his email. So within 15 days we cancel all that. We have our own domain, NMSF, and everybody is now using emails for internal communication. We have no papers now since 2010.
Very good. Can you tell me how your supply chain is organized? If I use the technical term, how is your supply chain designed, or what's your business model?
Yeah, as I said earlier, we are business-oriented organizations and self-financing at the same time, being public organizations. But we mainly supply the public organizations. We have two systems. Big organizations like National Health Insurance, and military, Ministry of Interior, police. These customers, they come and buy their medicine from us electronically. They submit their orders, and we send after the payment, or they pay later, we ship the goods to them. And the other model is our own branches and supplies to different 16 states to more than 2,680 different health facilities. We ship the goods to our branches, and from our branches on request to health facilities with supervision and cash collection system. Well, this is how we do it.
Again, as you have described, and from what I have seen, there is great progress here. What reforms have enabled this progress?
We started this reform in 2011, immediately after I took the office, I can say. And we started with the quality of medicines. We set measures to improve the quality of medicines. We set measures to improve the quality of services that we provide, like distribution of medicines. And later on, and actually before that, in 2012, we hired an expert to do assessment for the performance of our organizations, and we are now following the recommendation of that assessment. Actually, it was it is very valuable documents prepared by Health Research or Action in 2012, and then after that, even we changed the legal status of it was Central Medical Supplies Public Corporation, now it is National Medical Supplies Fund. So we changed the legal status, and we have our own act following the recommendation of that very valuable assessment report.
Very good. Let me now ask you a question on what many developing countries struggle with. Unskilled and unmotivated staff who are also poorly paid, and also very high attrition that many of these countries struggle with. I was talking to one of your staff earlier and asked her whether you are affected by the same issues, and she said no. Which wasn't a surprise, as I have seen happy and hardworking people nearly all who I came across, and nearly all those who I trained since 2015 are still here. No one has left. I asked her how NMSF has been able to retain people, and she pointed out to your leadership and open enabling environment, incentives, and that those are the key ingredients for a successful workforce development. She told me that they are not paid a lot, but that most prefer working for NMSF than be elsewhere. How have you been able to succeed where many still struggle? What have you been able to do to succeed in retaining your staff at all levels?
Yes, this is a very important question. And one day I tried to publish a paper on how to make people like civil servants working in a very progressive public organization to achieve, and within a very short period of time, great outcomes in their jobs. One of these, for example, the organization where I came from is our regulatory authority. I left them with 100 members of staff. After I left, within 2 years, more than 70% of them left the world. 70% of them left the world for Saudi Arabia or private sector in Sudan. When I joined this organization, as you mentioned, we within our reform, which started in 2011, we have a policy on human resources. And this policy includes the motivation of the staff is not all about salaries. I'm 100% convinced of that, because salaries may be one day, always demand is continually increasing and you can't reach the limit. So we invested in how to motivate people apart from paying them incentives. And although incentives is important, and we increase incentives 4 times, it's more than, not 4 times, I think 20 times is just doing that I found. But we also introduce other policies and strategies. One of them is good working condition and environment. Actually, the situation was different before, and now everybody has his own PC on his desk with very good, good environment at work level. We give them, training, give them opportunities to go outside to participate in conferences, workshops, meetings, training that you conducted for them, and try to, we try to, and also we install that, giving them that feeling of strong ownership feelings, and the national, I'm not going to say nationalism, but that they serve their country. And then also we give them other incentives like transportation from and to their homes, and then we also cover them by private health insurance. Although it is not you can say we pay them for public insurance. We pay them public insurance. We have to pay for public insurance, and then at the same time we give them a private insurance fully paid by the NMSF. This is why they are now feeling very satisfied. In addition to that, actually I'm a person who I delegated them fully. I didn't interfere. I just meet them on weekly basis, senior level. On a weekly basis, they just submit a report, and that is it. I didn't intervene. I do not, unless there is something arrogant or something like that. But I fully delegated them. And this kind of policies, you can't feel them, but the impact is very huge.
They feel empowered.
Empowered. Yes, exactly. And they know that because in other public organizations, they see their colleagues or their relatives or the people who they know, they don't, it is not like working in here. And even then, sometimes they compare them with their past. Or before I came, they know the management style at that time, and the big difference to delegating them, giving them a plan, and involve them, and this kind of things.
And actually, the same staff told me that their jobs in the private sector, that they could go to. Many of their colleagues who they graduated with went to the private sector. But she said that she prefers to be here. most people prefer to be here. That it's not only the money, and money is not the only motivation factor.
Yes.
And so they appreciate so much that you have done exactly what you've talked about. Yeah.
Yes, and we receive so many, requests actually. Always, especially from the, ministers, the, high-level people in the government. They try to bring some people, their relatives or who they know, to work in the NMSF, because now we have very good reputations, and we hope this will continue.
But what I've also liked about your approach is that you are not only focused on the central at the national level. For example, the group that we've just finished training this week came from the state level.
Yes.
All how many states are there?
16 states.
16 states, but we had 24 state staff. Of course, you had about 4 engineers, and that's also another great way of developing staff, that everyone is trained on the same thing, so that they have one way of thinking, one mentality, one approach, and therefore one vision. And for me, that was so impressive to see that your national staff were in the same room with the state staff. But I also remember last year when you were opening the training center, we launched the first training here where we were training the facility staff. The group that we trained last year were health facility staff. And this time we are training state level staff. But over the years, you've also been developing your own national leadership as well as state staff, because that's what I've seen happen. So it's the way that you have inculcated high standards through common ways of working, through common knowledge, common vocabulary, and therefore they think the same, and that's what I saw, which is so encouraging.
Yes, exactly. We try to transfer the same culture down to the bottom of the supply chain.
Very good. Obviously, all that you have done requires not only human, but also financial resources. What kind of budget in terms of size and source do you work with? Are you happy to share the budget size?
No problem. You know that our budget, because we are self-financing non-profitable working organizations, so we strike the balance between the availing budget for selling medicines to patients with the, our expansion, financing our expansion, our working environment, and this kind of things. So our markup, legal markups should be up to 15%. But during the past 3 or 4 years, we just limit ourselves to 13%, 12%. But we capitalize on increasing the volume of sales, which is normal. So
what does the markup?
The markup is that the markup we put on the cost of purchasing medicines or other health like medical. When we sell them to our customers or to the patient, we put like 13% at the central level.
And that covers distribution.
That covers distribution, warehousing, development budget, operational budget, and incentives, salaries. All we cover it from that. Last time it started. If we would like to talk about the last year, I think the last year budget is like 400 million Sudanese, like 32 million US dollars. 32 million US dollars. This is for
operations.
Yes, and this is a difference between purchase price and selling price.
Yeah.
So, and now last year 22, the year before, as I said, 32. This year, because of inflation, it is like come down to the 24 million US dollars
per year.
Per year. Yeah. So an average of 25 million per year for all these operations. Yes, development.
So all your money comes from the sale, which leads into surplus. Do you receive any money from the government?
No money from government, no money from donors for the past 25 years.
Wow. How do you ensure quality of your team's work, and especially for products, given that most countries suffer from falsified or substandard medicines?
We have a department for quality assurance and quality management. But maybe just seconds ago, I talked about the quality of medicines, and I presented a paper on experience of NMSF in assuring the quality of medicine. The first conference on medicine quality and public health in this world last month. And one of our main measures to control the medicines is to buy the last tender in 2008. Then after that, we stopped buying non-registered medicines. This first. Then we have certain categories of medicine which by law we have to buy them from certain sources, which are either originators or from stringent regulatory countries with stringent regulatory or from pre-qualified suppliers. And then also we do this, we invested a lot actually in warehousing, transportation, post-marketing surveillance for quality. All these measures we put in place to maintain the quality of medicines. And actually our outcomes are very impressive. We reduced the rejection rate for quality reason from on average 16% during the period from 2000 to 2010 to less than 1% since 2013.
That's amazing.
It's really very, very huge outcomes. So we reduce the waste of medicine, replacing the rejected medicines, all this we avoided bad reputation in the media, talking about the quality of NMSF. But now everybody, even people from private sector companies, they're restricting to us because everybody in Sudan now convinced that the quality of medicine provided by the NMSF is the best in this country.
My next question is on information for decision making. How do you ensure visibility into your work to have real-time, reliable information to make supply chain decisions, particularly demand planning?
Yeah, we actually are this area. You may say that is still this area of supply chain we need to improve it. But so far we use the issuing data. We decided on quantity of forecasting, and this also we are changing the other externalities like scarcity of hard currency, sanctions, and bank transactions. These problems, but we so far succeeded in doing good quantification and forecasting, and we measure this by the reduction of the expiration from 7% of the average of annual average of stock to less than 1% actually, less than 1% during the past 3 years. And also the availability of medicine increased from 46% in 2009 to more than 90% during the past 5 years. So this is how we improve the quantification, forecasting, reducing the waste, maintaining the availability of medicines. But for other policy and other decision making, actually we change the culture of this organ. Now we based on evidence. All policies, all strategic decisions of NMSF are taken based on evidence. We do a study, then after that we the recommendation, and we implement the recommendation based on evidence that we get from the study or the research that we do.
So I see you have ERP here at the central national level. You also have ERP at the state level?
Yes.
Yes?
Yes.
How does that work? So it's an integrated system?
Yes, it is. It is integrated system, and all invoicing system and everything. Our salaries, our holidays, everything is now computerized. And this is for you, for a person coming from West, maybe it's something normal, but it's a huge development in this country. Now we are fully automated organizations. Our sales, our procurement, our daily work from central and at the state level. And still you need to work hard to move to the service delivery point. But at the state level, at central level, we are fully automated organizations. And this is why government brings senior people to visit us. Ministers from Africa, the general director of the WHO, all these senior people who visited Sudan, our minister first bring them here to see the electronic, they call it here electronic government. So we are a model for the government using automation system, computerization of the daily operation.
Are you able to collect or receive data from health facilities for your demand planning, or how are you doing that? Have you gone that far, and or what is stopping you?
No, from health facilities to our state level, we collect data on manual. But from state level to the central level, this is all automated.
So what's the problem? Why not automate it from the health facility level?
Actually, for us, it's not a priority for the time being because it needs huge investment.
Yeah.
And we said that if we do not make it, still we have other priorities. The refurbishment of health facilities themselves, the improvement of the last mile service, training of the staff at the bottom of the supply chain. So we thought that, and even at the higher level at our administration board, they think that the time is still earlier to really invest in the automation of the supply chain and the service delivery point. But maybe in the coming future, we start with big hospitals and go down to the dispensary, because even the level of the cadre at that facility is not that much.
Network also is a problem.
Network is a problem.
Skills,
Sometimes
IT skills is a problem.
Electricity also is a problem. So this is. But maybe in 5 years' time, then we automated all the supply.
I mean, it's very interesting because Kenya, KEMSA, as you know, is Kenya Medical Supplies Agency, also is a transformed institution. And they also decided to focus on the central. I think they've managed to now computerize their state level. In Kenya, they call them counties. They managed to automate the system, the operations at the county level. But it's just now they are starting to think of the last mile, digitalizing the last mile supply chain. But as you say, they said they needed to concentrate first at the central level to make sure that things were working there before going to the front level. Because if you go there and this side is not sorted out, again you perhaps create more problems. So it just makes so much sense here. So what can you say is availability of medicine at the central medical warehouses?
I mentioned it, the availability at the central level, although there's a very big challenge, especially these days, in the scarcity of hard currency, exchange rate fluctuations. But fortunately enough, we improved the availability of medicines in terms, as mentioned earlier, in 2009 it was 46%. And at that time you have no problem of the hard currency. Hard currency is there. At that time there was no separation in one country or one country, the oil is there. The prices of oil at that time were very high. But after 2011, our country unfortunately split it into the oil done with the south. We start facing the scarcity of hard currency, inflation. We start facing the very rigid sanctions. But fortunately enough, because we invested a lot of human resources, we managed to increase the availability of medicines at the central level from 46% to the above 90%. And by World Health Organization measures, if an organization managed to avail medicine higher than 80%, that will be very high level of availability. So now we are above 90, fortunately enough. And
that's gold standard.
Yes, actually. And we calculated it when we say this medicine is available or not, if you have at least 1 month's stock. If it is only 29 days stock, we did not calculate it as available. We put it at 0. And the number of medicines increased from a limited number of medicines, 400 or something, to more than now 1,000 different medicines.
Wow. I read somewhere that your distribution is integrated.
Our target, we have 3,341 health facilities. This includes hospitals, health centers, and dispensaries. Our coverage is now 80% of these health facilities are enrolled in our national supply chain. So we have now 2,681 different health facilities supplied through NMSF branches in different states, in 16 states. So,
and how do you measure performance, and which key indicators do you prioritize and why?
Actually, we have like 18 different indicators. But the main indicators, we have the availability of medicines at central, at the state, and at facility level. And then we have the expiration rate. We have the rejection rate for quality reasons. We have, physical count and the stock inventory control. We measure the physical count with theoretical stock, and we also measure our coverage, geographical coverage. Like now I said, just 80%. This is one of them, and there's so many others. The purchases through tenders, purchases through direct purchase, close tenders, purchasing from national list of essential medicines, and this so many indicators. And these indicators, we abstracted them actually from WHO, from USAID, and from MSH, Management Science for Health. So we collate all these indicators and we put gold standards on our achievement.
Wow.
Yeah.
Of course, so much has happened over the past few years. Tell me about your success factors.
I think there is a number of factors. The very important one, as our colleague from Malawi asked me, how did you manage to get the president himself to visit you? And you know, since I came here as the president himself, His Excellency, the president visits NMSF 3 times.
That's 10 years?
This is like 8 years.
8 years.
During 8 years, he visited us 3 times. His first vice president visited us 2 times. The vice president also we have 3. Vice president visits us 3 times. And the new prime minister visits us immediately after he has been appointed. 1 week he visited us. So this kind of political commitment encourages us actually to work very hard. And in addition, they praised what we have done. And this political commitment is a very major success factor. And this is represented apart from this emotional or motivated one in the terms of changing the legal status. And without the support of His Excellency the President, we cannot, pass this act to the Parliament. Process should be accepted by the Council of Ministers. Then they also they give us foreign currency at a very special rate. And then they supported us by giving us this commitment to open these branches in different states, because it is not an easy job to do all this, because sometimes there's some conflict. So in addition to that, actually cooperation with other partners like the regulator or secretary of the country and other like National Health Insurance, working with
Sudan Post.
Yes, Sudan Post. Here for the transportation. So all this commitment and cooperation, human resources, committed staff, actually helping us. And even myself, I learned a lot. I study experience of others, and then try to implement the learning lessons from other similar organizations. So I think all these factors help us to.
Yeah, and when I was talking to your staff, I called them students because they were my trainees for this whole week. When I was talking to them, they also said that they've been equipped with the tools, the resources they need. They have vehicles, pickups to do deliveries to the facility level. They are provided with computers at that level. There are warehouses, enough space to store the commodities. All this NMSF here managed to fund. A lot of all these, all these things you've done with your own money, because I know, as I've read and as you've shared with me, or your colleagues have shared with me, that over the years you've suffered a lot of, out of the 26 years of sanctions, and also hard cash, inflation. Still, you've turned your threat into opportunity, and you've done amazingly. I'm seeing wonderful work here. How will you ensure self-sustaining supply chain for your country going forward? How do you sustain all these successes? How do you achieve self-sustaining supply chain going forward for this country?
Yes, because one of the very important factors that we maintain this sustainability, because since we started this organization in 1991 as autonomous organizations using its own money, now more than 25 years revolving. But to continue, we have now our own act, and this act, nobody can, according to this act, nobody can dissolve this organization unless by parliament decision. So we maintain this, and all our staff and all this kind of autonomous is just, organized by act, so nobody can to some extent nobody can touch actually, let us say. So this is one of the main factors that will sustain this performance.
Of course, if the staff also maintain the same high standards.
High
that they
standard,
used to
if they have also a good leaders or
Yeah.
somebody who will lead them for the future, that is very important.
Yeah. I see everyone here wearing uniform, and I see you as the Director General. Every time I come here, I find you in the uniform, and sometimes it's difficult to tell who is Dr. Gamal and who is the junior staff here, because the uniform sort of makes you all look alike. I only remember the day I saw you in your suit was the day that the president was opening the training center last year in April. How did you come up with this idea of wearing uniform, and how have you enforced it that all staff wear uniform, all staff look so smart, all staff look so equal?
Yes, leading by model is very important to me. So if you ask them to come at 7 o'clock, you have to come at 7 o'clock. If you ask them to dress uniform, you have to dress. And even sometimes it creates a problems for me when I go to meeting outside with the senior staff of the government, and they used to see me just dressed blue and black. And some of them ask me, "You have no other clothes?" I say, no, sorry, this is a uniform. And then they surprised that a Director General having a uniform. This is very strange. But actually I'm not want to talk about it, but it is one of our leader, our Prophet Muhammad saying that if you shouldn't be distinguished from people who you sit with, and for himself even hardly to be distinguished from his followers. So this is one of our cultures. If you want people to follow you or to listen to you or to accept or perceive your message or your ideas or values, norms, you have to be like them, eating with them, sitting with them, dressed like them. And this arrogant or this is not good.
Powerful. So if we supply chain professionals can do our part in really strengthening the supply chain systems in our countries, I'm sure that is half the battle won. Having people with the right skill, demonstrable competence to make supply chain decisions is one step, and of course resources, enabling environment at the outside supply chain, because supply chain is often a victim of wider factors of leadership and governance, of lack of information for decision making, lack of competent workforce, poor infrastructure, and so forth and so forth. But I think from what I've heard you say, but also what I have seen around your compound here since my engagement with NMSF is impressive. It shows that things can happen, but they require leadership, they require leaders with vision, they require commitment, because you did not just do it, you did not find it easy to do it. And so many people would have quit, have left halfway. 8 years on, you are still here, and you've done so much, you've done so well with your team, and let's give them credit and just thank you and thank everyone again. So it's really great pleasure.
Very well.
Really.
And I would like also to thank them through you, because they helped me a lot to do my work.
Thank you again. Wonderful.